Hello and welcome to this screencast. My name's Thomas Gray. I'm a Clinical Leadership and Education Fellow at Sheffield Teaching Hospitals. I'm also an Obstetrics and Gynecology Registrar. I want to talk to you today about a new smartphone app which is called Healthcare Supervision Logbook, which has been developed at Sheffield Teaching Hospitals NHS Foundation Trust by myself and Professor Tom Farrell. I'm going to talk through the app, explain how it works and what the different functions are. This is a simple screenshot from the login screen of the app. I'm just going to take you through some information about the app, how it works, what it does and what it can be used for. So Healthcare Supervision Logbook is a new smartphone app which has been produced at Sheffield Teaching Hospitals NHS Foundation Trust. It's an app that works on smartphones, so it works on the Apple iOS system and on the Google Android operating system. There's also a desktop version of the app, and the app is essentially a new concept for providing feedback on medical education. It's also got functions which support appraisal and revalidation for doctors in training, so trainees, and also for trainers who would typically be consultants working within the NHS. It's got a number of functions, Healthcare Supervision Logbook. It can support revalidation for trainers. It allows trainers to provide sessional feedback about the performance of trainees who they're supervising. It allows trainees to assess their training. It can be used to facilitate the annual review of trainees' training, which is known as an ARCP, and it also helps to promote a culture of high quality training and education, which is the main reason that the smartphone app has been produced. Again, this is a screenshot from the app which shows what it looks like when you're turning it on your phone. So what does Healthcare Supervision Logbook do for trainees? Well, trainees are able to use this app to record feedback on their perceived value of the educational content, including their perceived value of the clinical and educational supervision they've received from their trainer after each clinical session they do. So for example, a clinic or a theatre session or an on-call session. At the end of the session, the trainee would be able to use the smartphone app to basically record feedback about the session, including the educational supervision they've received during that session. It basically is a way of collecting daily feedback on the perceived quality of training from the trainee's perspective. So what does Healthcare Supervision Logbook do for trainers? So for trainers, so consultants who are supervising the doctor in training or trainee. Well, it allows trainers or supervisors to record feedback on the trainee's performance after each clinical session they do with them. So for example, a theatre session or clinic session. At the end of the session, the trainer is able to fill in the feedback form about that trainee's performance within that session. It's a way of collecting daily or sessional, so session by session, multi-source feedback on the trainee's performance. And what I mean by that is, by the multi-source part, is that this will be done by multiple trainers who are training that particular trainee. So the trainee will have a number of different feedback entries from different trainers throughout the months and years that they are training. The crucial part of the app to make this work effectively is the content management system. And this is effectively the database that all of the feedback entries go onto when they're filled in on the smartphone. So the content management system allows the data to be easily analysed by the training program leaders and used to enhance the training. So for example, you can produce a report for each trainee looking at all the feedback entries about their performance in particular sessions. You can then use that data to compare them to others working in the department at their level or globally, and that basically means that the entries that are fed back about the trainee's performance can be used to assess how they're doing in their training. You can also use it to look at the sessions feedback that's been provided by the trainees, so you can see if there's areas for development within the training that they're receiving. The content management system is very useful because it allows the content of the app, so the things that are on the particular forms for providing feedback within the app, to be modified for different specialties and different disciplines, which means that this app can basically be changed in order to be useful for different specialties, because different specialties will have particular things that they're interested in compared with others. So that's why it's very, very useful. So what does Healthcare Supervision Logbook do for both trainers and trainees? Well, it helps to provide evidence of clinical activities, and it helps to provide evidence of educational and clinical supervision activities. So these are very useful for purposes of appraisal and for revalidation. They're also useful for the trainee at their ARCP to provide evidence of their activities throughout the year. There's also a comprehensive logbook of practical procedures as part of the app, and this is modifiable by specialty, so it'll be able to be used by any specialty that uses the app. And there's also a simple way of collecting patient and colleague feedback built into the app. So there are a number of useful purposes there for both trainee and trainer alike. This is what the smartphone app looks like. There's a home screen with 4 menu items: logbook, sessions, training and patient. There are essentially 4 menu items for the trainer version and 3 menu items for the trainee version. So there's a separate trainer version and a separate trainee version. The trainer version has the 4 items, which will be logbook, sessions, training and patient. The trainee version has 3 menu items, so all the items apart from the training component of the app. So the sessions component of the app, first of all, this is used by trainees to basically complete a feedback entry for each session that they undertake. So for example, a clinic session, a theatre session, a teaching session, an on-call session. During when they fill that form in, they're basically able to critique the timing of the sessions. Did the session start on time? Did it end on time? They're able to record details of the session, so the number of new patients they've seen, the number of follow-up patients they've seen if they're doing a clinic, for example. There's a question about whether they've received feedback in the session and about whether they've been offered work-based assessments in the session. There's also a question about undermining that they're asked in the sessions. They're asked to say whether they felt undermined. And currently this is anonymised for trainer, so when the trainee feeds back about the session that they've done, they don't name the trainer who was supervising them during that session. But there is a facility for us to add that, so we could make this so that it could be possible to name the person who's providing training in the session. The trainers also use this function in the app, but they have a pared down version. Simply means that they can record their clinical activities. So for instance, they're not asked about work-based assessments, they're not asked about whether they've received feedback during the session, because obviously those are only pertinent for trainees. So this can be used by the trainee to record their feedback on their perceived value of the educational content of the session, including the educational and clinical supervision they've received. And it can be used by trainers simply as a way to record their clinical activities. So this is an example of what the screen looks like. You can see here it's for a theatre session. They're asked about their timekeeping, so did the session start on time, did the session end on time? They're able to record the number of minor cases that they've performed and the number of major cases they've performed. They're also able to say if the surgical training was affected by, for example, time pressures or consultant decision or complications. They're also able to say whether they had time to see the patients post-operatively and whether they felt undermined during the session. And with regard to the undermining, they're simply asked to say whether they're undermined or not, and if they are undermined, whether they reported it or not, and if they were undermined, by whom. So was it a consultant, was it a trainee, was it a midwife, was it a nurse, for example. And if they say that they were undermined but they say they haven't reported it, that triggers an email to go to the person filling that in to remind them about the bullying and undermining policy in the hospital. And this is essentially a soft way of reporting undermining. It means that there's an easy mechanism for doing so, and that it's non-confrontational. So hopefully this will facilitate reporting of undermining where it occurs so that it can be swiftly dealt with. Moving on to the next section of the app. So we've talked about the sessions section. We're going to talk now about the training section of the app. So the training section is only present in the trainer's version of the smartphone app. Healthcare Supervision Logbook only uses this for trainers. So essentially, with the trainee is selected from a list on the menu, and the trainer completes this after each session. So if the trainer has done a theatre session with the trainee, for example, they would fill a feedback form in, and this obviously will be filled in by multiple trainers who are training the particular individual trainee over the different sessions. And effectively it provides daily sessional multi-source feedback about that trainee's performance. So this is an example of the feedback form that we get. This is 3 screenshots showing you what the form would look like. So you select the session type, so in the case it's a theatre session. Was the trainee punctual or not? Was the case mix correct for the trainee or not? Were work-based assessments completed or not? Was feedback provided to the trainee or not? And then we have these 5-point visual analog scales on which you can rate the trainee for the features that are, these are ones that are included in the Obs and Gynae TO1, TO2, but they're similar for each specialty. So for example, empathy and respect, team working, verbal communication skills, insight and clinical judgment, operative skills for stage of training. So for each of these items you're able to rate the trainee on a 5-point scale to assess their performance in the session. And obviously when you look at the content management system you can select the trainee on there, and then you can see an overall sort of score for each of the for how they're doing on these areas. You can collate them together to see the mean value that they're getting and the modal value that they're getting, and you can compare that with the other trainees in the department, see how that trainee is performing. I'll now talk about the logbook session of the app. So the logbook session is totally modifiable by specialty. At the moment it's mapped for obstetrics and gynecology, but we're currently making logbooks for paediatrics and for anaesthetics, and it's possible to make a logbook for any specialty. It can be organised into different menus. The entries are time stamped, and you're able to record the level of supervision and any complications that have occurred. We can also put mandatory items in the logbook. So for instance, when you start a new placement you have to do mandatory training on consent, or mandatory training, for instance in obstetrics and gynecology you have to attend the annual skills and drills course. So those items can be placed in a mandatory folder in the logbook. So when you're looking at the trainees log for them, you can basically see whether or not they've done these mandatory items. There's also an option to add a video link to items within the logbook. So for instance, if there's an emergency item like a resuscitation, or in obstetrics and gynecology, for example, shoulder dystocia or a postpartum hemorrhage, you can put a video link, a link to a video or a link to a guideline, which can be used to aid the reflective process for the trainee. This is a screenshot of the logbook section, so you can see we have here obstetrics and gynecology is the department, and we've selected labelled skills and then fetal blood sampling. You can record whether you did this independently or not, whether there are any complications and comments and notes about it. And this is very useful for both trainers and trainees alike, who can record all of their clinical activities. Finally, I'm just going to talk to you about the patient component of the app. So this is actually going to be renamed surveys, because there's options in there for both patient and colleagues. So it's a mechanism for collecting both patient and colleague feedback. You can basically send an email out to a patient or a colleague with a link to a feedback form. And the feedback form from patients or colleagues can then be collected and collated. So this is an example of what it looks like. You basically write the colleague's or the patient's name in there, the patient's email address, and then you send them a message. And obviously this is all secure. It's recorded and it's kept on a database that's at Sheffield Teaching Hospitals, so there's no confidentiality issues here. The main take-home messages about the app are that it supports revalidation for trainers and it supports training. It also supports the ARCP process. So it supports revalidation for trainers because you're able to use the app to record daily activities and record the practical procedures that you do. You can use the app to provide evidence of daily education and clinical supervision that you provide to trainees, and you can also use it to collect GMC approved patient feedback and GMC approved colleague feedback as well, using the feedback function on the app. It also supports training, so the sessional training, sessional feedback from the trainees on their perceived value of the training allows the trainees to assess their training on a daily basis. So areas of concern or any patterns that emerge can be dealt with by the training program coordinators. Also undermining can be detected as well, and also there is an opportunity for logging procedures and activities and providing evidence of your training and supporting of reflective practice through the video link that I've mentioned. It supports the ARCP process for trainees because the daily multi-source feedback provided by the trainers can be used to provide evidence of the trainee's performance across the year. The content management system can be used to produce individualised reports with mean and modal values for the individual versus the department, and the number and type of each session can also be recorded. You can also see the trainee's logbook entries at the RCP, and there's a large amount of data there that's going to be easy to see and assess. So it's been a pleasure to talk to you about Healthcare Supervision Logbook. The plan is to roll this out across Sheffield Teaching Hospitals from January, and we'd be very happy to answer any questions that anyone has about this new exciting smartphone app and content management system. Thank you very much.